Good evening, everyone. This is Tracy Kelly again, and tonight my video is going to be about coding and cross-checking codes. So let's get started. What is medical coding? Medical coding is a transformation of healthcare services such as diagnosis, procedures, and equipment into medical alphanumeric codes. The diagnosis and procedure codes are assigned by reviewing the patient's medical record, such as the laboratory notes, physician notes, and radiology results. After reviewing the medical documentation, the codes are then entered into the patient's chart and ready for cross-checking. The purpose of cross-checking is to ensure all assigned codes are correct before claim submission. Because in most cases, sometimes the wrong code could be assigned to the claim, which was from the previous coding year, which is reviewed from the coding books that come out every year. So we just want to make sure each code is correct based on the year that it was published and is matching the services the patient received. The purpose of diagnosis codes. Insurance reimbursement. Each service provided to the patient must have a diagnosis code. This is to report the reason for the service or procedure that the patient received. The purpose of CPT codes. The CPT code is a medical code set that's used to report any medical services, surgical, and diagnostic procedures to entities such as physicians, health insurance companies, and accreditation organization. Examples of diagnosis and procedure codes. To my left, I have here examples of some diagnosis codes. For instance, diagnosis for migraine. The code that will be assigned would be G43.909. And I also have a listing here for diagnosis for a broken finger, which would be S6206. And the third one I have listed is abscess of the bladder, which is N30.80. And for the procedure codes, I have for the evaluation and management, there's a code range of 99201 through 99499. For anesthesia, for example, the codes that could be assigned would be 00100 through 01999. Also 99100 through 99140. So these codes will be assigned based on the diagnosis given by the physician, as well as the services that were provided to the patient by the physician. So that's just wanted to give a couple of examples of what those codes look like. How to look up a diagnosis code. ICD-9 codes, which is the International Classification of Diseases codes, are located in patients' charts, which includes hospital records, physician records, and death certificates. The 10th version of the code is currently used, which is called ICD-9-10. Two lists are needed when locating a diagnosis code. You need your alphabetical index of diagnosis terms, which is located in the back of the book. And you also have your tabular list of diagnosis codes. There are 5 steps to the process. And I have a little example of how that book looks. It changes every year, but yeah, that's pretty much the updated version. 5 steps to locating a diagnosis code. Number 1, you would search for the alphabetical index for the diagnosis term. Number 2, you would check the tabular list. Number 3, you would read the code instructions. Number 4, if it is an injury or a trauma, you would add the 7th character. The 7th character, along with that, you would also indicate the letters I have here to the left. You have your A, which is to indicate the initial encounter, D, which is for the subsequent encounter, and then S is for the sequela, which is any visits after that second one. And then 5, for some diagnosis, the tabular list instructs to add a 7th character, which I have here listed: 0, which is for stage unspecified, 1 for mild, 2 for moderate, 3 for severe, and 4 for indeterminate. So that's pretty much if they can't determine for some reason. That's the code, the digit you would add. Just wanted to cover those. And then I also have a slide here showing how to locate a CPT code. There are 2 categories to check when locating a CPT code. Category 1, the codes that are arranged by the numerical range. Example, evaluation and management. You have 99201- through -99499. Then you have anesthesia. Then you have your surgical codes. You have your radiology. Then you have your pathology and laboratory codes, as well as your medicine codes. So that's pretty much the range you would use to assign to any procedures that the patients were given. And for category 2, these codes combine a number of procedures that typically occur in a conjunction with one main procedure. Example, you have for your heart failure assessed 0001F, which includes all of the following: your blood pressure measured, your level of activity assessed, clinical symptoms of volume overload assessed, weight recorded, and clinical signs of volume overload assessed. And I have here a little notation stating that category 2 would be the first place to locate that procedure. And then you would go back to category 1. It's a little complicated to explain without demonstration, but with practice, you could become a pro at it. I've been doing it for years, and it's like automatically, I know exactly where to go. But that comes with practice. And once you start coding visits or using those manuals, it becomes second nature to you. Cross-checking codes. Cross-checking codes occurs when a coder reviews codes that have been assigned for accuracy to ensure the codes are correct. The goal is to submit the claim the first time to make sure the claim is not going to be rejected or denied. So you pretty much cover every area on that claim to make sure everything's correct before submitting it. And once everything has been reviewed, the claim can be submitted. Category 3 here as far as the CPT codes. The third category of CPT codes is made up of temporary codes, which are emergent or experimental codes or services, technology, and procedures. In certain cases, you may find that a newer procedure does not have a category. These are the codes in that category for unlisted procedures. So this is where you would go to for anything that's not listed, and it would direct you where to go from there. And that's pretty much all I have for this video here. And I just want to thank you so much again for your time, and stay tuned for video 6, which we will be talking about filing the charges once the claim has been reviewed for your codes and ready to go. So that would be the next video. And I look forward to seeing you then. And don't forget to hit the subscribe button at the bottom of the screen. And thank you so much again for your time. Have a good evening. Night night.